Good morning, afternoon, evening, whatever time you're watching this video. My name is Francis. Today I want to discuss about the complications I had with the leukemia and different symptoms I got with leukemia. The type of leukemia I have is a CMML, stage 2. Um, Before I go into that, I'd like to apologize for the lighting in this room. This is one of our darker room in our house. I got a bit of a headache going on, and staying in this room when it's quiet, it helps out. Um, anyway, when doctors give you medication when you're first diagnosed, don't blindly take medicines they give you. Make sure you do the research on what the side effects are, because sometimes the side effect is far worse than what you're dealing with. For instance, I took allopurinol when I first got diagnosed with the CMML2, not when I got the leukemia diagnosis, but actual after the bone marrow biopsy, and it came out that I have a CMML stage 2. Um, I explained the difference between stage 4 and stage 2 of my cancer in my last camping video. But when I took allopurinol, and the purpose of allopurinol is to lower your uric acid level down. It's to protect your kidneys. Um, the doc she didn't give me this medication out of maliciousness or anything like that. She was just trying to do her job, make sure I'm healthy enough to receive the chemo. But it had a adverse effect on me. The first time I took the allopurinol, the day I got prescribed with it, I felt something was off with my lower back on the right side. The second, because one pill per day, so second day I took the pill in the morning, my urine was pink. Hardly noticeable, but I don't know how many people actually look at their urines or whatever they do in the bathroom. I always look at it because that I'm used to it. It just that's how I know. Oh, I'm a little dehydrated. My urine looked darker than usual, or I need to have more water intake. Whatever the reason is. But I noticed it was pink. On the third day I took it, the pain got worse, and I started urinating blood. Um, so I never urinated blood before, so it freaked me out. Um, so I called the 800 number the cancer center gives you, so you can speak to a oncologist on duty, and they can recommend certain steps for you before you go to the ER or before you contact your oncologist. At least that's how University of Maryland works. So I called that number and they said, if you're urinating blood, you have to go to the ER right now. I said, okay. So me and my wife and the doctor said, more than likely they're going to hospitalize me. So I packed 2 weeks worth of clothes, at least underwears and socks. I don't mind wearing hospital gowns, but I'm not wearing the same underwear for 2 weeks. So I got a backpack full of change of clothes, went to the ER. My wife and I, we waited for 10 hours. Even though they acknowledged that they knew I was a cancer patient at the hospital, I was just not, apparently I was not dying enough for them to check me out. So for 10 hours, I was hunched over in pain. The nurses or anybody in that emergency department would not even give me Tylenol. Nothing. So that's 10 hours of agony, painful, you know, lower back. I thought something was seriously wrong with me. And after 10 hours, we left. I gave them a urine sample and they told me my urine was too bloody to find out what's going on. When it's that cloudy with blood, they normally can't find what's wrong with it. Well, I guess the only test you're going to do in 10 hours, and they pretty much say yes. I said, I take this IV line out of my arm. I got a doctor visit tomorrow morning. So I saw my oncologist the following morning, and she made an appointment with the urologist to find out where the bleeding is coming from. After I seen the urologist, but she told me stop taking allopurinol. I said, I already did. I already threw that away because I know as soon as I took that medicine, something was wrong. Um, One of the side effects of allopurinol is causing bloody urine. It also causes um, kidney stones. So they assumed I had a kidney stone, and they say it's gonna pass. No CAT scan yet because after they did the blood test, they found out my kidney function was very low. So, they can't do a contrast CAT scan to find out if I have stones or not. But they did a CAT scan anyway without the contrast, just to see if they can visually see some kind of tear or something. It shows nothing. It showed perfectly healthy kidneys other than swelling. So I said, okay, well, that's not too bad of a news. The pain traveled from the lower back to the side to the front towards my bladder. And during those time, I was urinating blood clots bigger than the size of my thumb. I mean, we're talking huge blood clots. Um, and I called again that emergency number for the cancer patient, and they told me, yeah, go to the emergency room. If you're urinating blood and now you're passing blood clots, you have to go to the emergency room. This time I didn't listen. Um, I'm kind of glad I didn't, because that's another 10 hours I would have wasted. And when I spoke to the urologist, they say, yeah, you're passing blood clots because you're urinating blood so much. That's not that uncommon. Plus, the blood clot is sterile once it's inside your body, so it's not going to harm anything. Especially if it's in the urinal tract, because I'm just going to urinate it out. Um, which I thought blood clot was dangerous, but apparently not this one. And then another CAT scan was performed once my kidney healed enough to take the contrast. It showed nothing other than swelling. Swelling went down, and I was taking oxy. Well, it's only 5 milligram oxy, but they give you plenty of pain medication because you got cancer and your body's gonna hurt. And boy, it does hurt. And then about a week later, I had a similar pain on the left side of my kidney. It started from the back side, and it traveled to the side and to the front way faster than the right side did. Back to urinating blood again, and they scheduled a cystoscopy. I don't know what the medical name is, but when they stick a camera up in your P tube and find out if your bladder is bleeding or if your kidneys are bleeding. So that's another surgical procedure I have to go through. They found out my left kidney was bleeding, obviously, because my right kidney stopped hurting about a week ago. My left one started, and that's where the bleeding's coming from. What's causing the bleeding? I asked the doctor, and they said they don't know. Looks like a pre-existing condition is what they said. I never had a kidney problem, you know. But now all of a sudden I got pre-existing kidney condition that caused me to bleed, and I urinate, blood. So I'm still thinking it's the medication, because once the pain passed, I stopped urinating blood and stopped passing blood clots. And right now I haven't urinated blood in almost a month, you know. So I'm glad. I'm glad about that. But, just taking the medicine blindly without knowing what the side effects are, what it's going to do to your body, you're just taking chances. I'm sure that the medication is designed to help you out, but me, I, my doctor even said, she had never met a patient that has more side effects from the medications than me. Maybe, but if you do medication search for allopurinol, yeah, it's a very common problem that people's passing kidney stone. It's tearing their kidneys, it's tearing them up. That's what's causing the bleeding. My kidney swells up so bad, and the tissue expands, and that's what's tearing things up, and that's where the bleeding is coming from. So now, every time I get new medication, I do thorough research, and I take them if I feel as though I need to. But if I don't, I consult with my doctor and say, "Why did you give me this medication? And is this really necessary for my treatment?" And they'll tell me either yes or no. Some things you just can't argue with because it's part of the treatment. If you refuse treatment, I guess they can deny treatment. I'm not sure. But if this is an absolute must, then yeah, you should take it. But if you have any doubts, do your research on medications you're on. So that was surgery number one, which was, finding out which kidney was bleeding and why it's bleeding. Surgery number two is when they put this access port, because your arm veins and your leg veins will fry, because you have to go see doctor 2 to 3 times a week for lab work to see where your blast counts are at. If you need blood transfusion, if you need fluid, that's how they find out by through doing lab work. So after getting your arms punctured on both arms, your arm will get tired of it eventually. My arms lasted me 2 months before it was fried to the point where I couldn't take another needle. Um, Not that because it was painful, because my veins would collapse. And because of chemo going through my veins and my arms, it just weakens the structure. I never had a vein that rolled, but now my veins roll. Um, so it was a nightmare getting the IVs. So I got this port put in my chest. Um, that's when we found out the twilight sleep the hospital do for you, so you're a little bit more comfortable during light procedure like this. We learned that twilight doesn't work on me with 3 additional doses. So 4 doses of twilight sleep did not work on me. I was wide awake. So when they cut me open, I didn't feel it because they had the numbing injection done. But when they were creating a pocket inside my chest cavity for this device to go in, I felt every single second of that. And I had to constantly speak to the surgeon about non-related topic like fishing. I said, I bet you guys are really great at fishing because you can make heck of knots. So we're all joking, and while we're doing that, the pain was so bad that I was crying. I was laying down, my blood pressure shooting up, and I was shaking because the pain was so severe and they couldn't put me out. Because the procedure was halfway through, they could not really knock me out, because I was there for another 10, 15 minutes. So all they had to do was stitch me back up. They told me the worst of the pain is over, the creating the pocket. Um, so that was relatively uncomfortable, to say the least. Bone marrow testing. That don't feel too good neither. I felt the needle grinding against my hip bone as they turn left and right to dig into the bone so they can get to the marrow and get their samples out. And then they use a bigger cutting device on top of the hole to get an actual piece of your hip bone, so they can do the analyze on the hip bone. That hurt pretty bad too. So next time I'm supposed to be getting that procedure done at the surgical center, um, because again the twilight doesn't work, and for some reason the numbing medication, the lidocaine injection, it doesn't work very well for me. So I I feel quite a bit of it. Um, Another things that goes to you, you'll have blisters in your mouth, uh, like that. I don't know if you can see it or not. Blood blisters, all inside your gum lines, inside your cheeks, your lips. It's not because I bit them during a supper or whatever. It just happens. Just like you get these tiny little red blotches all over your body. That's because your blood vessels are blown up. It's popping inside your body because of leukemia. And it's happening inside where the small blood vessels, they pop and you get the blood blisters. Another thing is, everybody gets it. Not too many people would feel it. They said about 25% of the patients who goes through chemo will have a thing called chemo brain. Sounds made up, but it's that's one of the terms they use it for. Apparently, I got diagnosed with chemo brain because I couldn't quite think straight. Everything was foggy, and like I couldn't remember what day it was, and I'm just dizzy all the time. And when I asked the doctor about that, it's like, "Oh, you have chemo brain." I'm like, "Excuse me?" I'm like, "Yeah, chemo's reacting to your brain, and the blast cells going to your brain, and yeah, you're gonna have some kind of a discomfort." Um, so chemo brain is like confusion. It's almost like a Alzheimer's, I guess. You're asking the same question over and over again. You're kind of not with it. I have good days and bad days. Today is one of the better days, other than this headache, this migraine, temple to temple, heartbeat behind my eyeball pain. Um, so I got those. Out of all the side effects I can get, one thing I did not get was losing my hair from the chemo. I'm going through an intensive chemo treatment, which means in 1 month I go through chemo treatment 7 days straight. So when it starts on Monday, it ends on Sunday. Um, and you get that done once a month. And They give you 3 weeks for your body to heal before they give you another treatment, week-long treatment. Um, so I already did my third. I got fourth round of chemo coming up in a week. Um, this time, for some reason, I lost my taste bud late. I'm feeling very weak, and this is happening to me kind of late. When I first got my chemo, I didn't really feel the effect till a week later. I'm feeling weak and just completely out of it, and I feel like I bounced back from it fairly quick. About a week later, I was almost back to normal. I can do normal things. Um, and your taste bud, it'll fry your taste bud for about 2 to 3 weeks. Um, just about time when you get your taste buds back, you have to go through another round of chemo, and it'll kill your taste buds. So, to be fair, in past 4 months, I think I might remember what food tastes like, maybe about a week's worth of time. Um, the flavor that lasts the longest in my mouth that I can remember is sweetness, and I can remember spicy. But far as the taste of steaks or everything tastes like bland chicken to me, no matter what I eat. Oh, you can't have sushis. You cannot have medium steaks. It has to be well done. Everything has to be cooked well done. Because you can't afford to have food poisoning from meat that is halfway cooked or raw meat. You just can't take that chance. Same reason why I can't do a lot of things that I used to do, because if I have internal bleeding, um, they would not be able to stop it. Even with the surgery, they can't stop it. Just having this chest port put on, um, I bled for about 2 weeks straight, and we're talking soaked band-aid 2 weeks straight. And I got two additional blood transfusions from this, just from getting this done, because my stitches were not stopped bleeding. And this is not always 100% guarantee that it's going to work, because today at the hospital, when I got my lab work done, this failed. The nurse missed the diaphragm about this big. That's how big the diaphragm is, and she missed it twice. So that got real sensitive, so they had to go back to old-fashioned IV line in the arm. So I got the IV put on, and it turns out I didn't need any further treatment. I didn't need any blood today. I didn't need any the fluids. I didn't need any medication, nothing. So I was just there for lab work. So this was unnecessary pain, to say the least. Because this really hurts. I don't know, because it's still new and I'm sensitive to it, but when she poked me the first time, that wasn't too terrible. And I had a huge scab on the side, and she ripped that scab off, and I felt the pain on the inside of my skin. So it was still attached to me on the inside where the stitches are. She ripped that out, cleaned it with the alcohol, burnt like I don't know what. But they still had to pack. You see how thick the band-aid is. They had to pack it like this because I was bleeding so bad. So discard this for today. Use my arm the old-fashioned way, because like I said, this is not guaranteed. It all depending on who your technicians are. If they know what they're doing, obviously they'll get it. If they don't, like today, oh Lord, how do these people even pass schooling? And these are the type of people that is taking care of you. So I'm scared. I'm scared to go to the hospital these days, because the lack of tension from the hospital staff is unreal. Their face is buried on their phone, and when they're not buried on their phone, half of them is rude, extremely rude. Others, they seem like they genuinely care, but most of them, they couldn't care less if you live or die. If I say I'm the only one, then that's one thing. But now I witnessed this with several different patients. Yeah, there's so much going on. It makes your body feel so weak with this cancer. It doesn't allow you to do anything that you want to do. Even though when your mind feels like you can do it, your body won't let you. When your body feels like you can do it, your mind won't let you. So it's not just a physical thing, it's a mental thing too. And to me, it seems like my body's playing game with me. Let me see how far I can hold you back today. That's what it feels like. Forget about sleeping. I haven't slept pretty much in about 4 months, going on 4 months. I sleep an hour or two, but I don't know, because of the kidney problem I had. I urinate every hour now, almost like clockwork. Sometimes I can hold it off till 2 hours, but never more than 2 hours. So that disrupts my sleep. Um, so I haven't had a good night's sleep, so I'm always sounding tired. Um, so I know the video's getting a little bit too long, but if you have any questions or comments, or if you're going through this just like me, the beginning stage, or going through treatments and you're concerned about certain things, um, leave me a comment. You know. All right. I'll see you guys next time.